Hello everyone, my name is Aspicio, or you can call me Jayr. I'm here to present to you guys regarding a patient who developed stroke symptoms such as slurred speech that may be related to AFib and other comorbidities. I just want to start off on the most common cause of stroke is a blood clot. AFib put patients at an increased risk for stroke because blood may not be properly pumped out of the heart, which may cause it to pull and form a clot. This clot can travel to the brain and may cause the symptom of stroke. There are factors that may contribute to stroke, such as diabetes, hypertension, and congestive heart failure. Okay. And my patient was a 73-year-old male who was African American, retired construction worker, worked as a middle class, and he was married and with two children. Health insurance wise, patient has medical and Medicare for billing purposes. When he came in, patient was not a candidate for TPA due to low platelet level, which makes him prone to bleeding. Also, patient had a Coumadin therapy prior to admission. Patient also has CHF and he gets Midamor treatment, which is an hypertensive medication. Also, he has a kidney cancer. So he has history of chemotherapy. Then the patient had nephrectomy back in 2006, and from there on, patient's been on hemodialysis from Monday, Wednesday, and Friday. And along the way, patient's been developing other complications related to his conditions. There are like non-pharmacological treatments to stroke, such as patient may be benefited from physical therapy or occupational therapy, and while in the hospital, he needs to be monitored on tele, such as we want to see if the AFib is controlled or not, and also we may need lipid panel to be done because patients cholesterol level may be elevated, so we may need to start him on statin medications. For AFib wise, since patient has history of also tachyarrhythmia, patient was placed on AICD and also pacemaker. For CHF, what we can do, patient should be on a 2-gram low sodium diet, fluid restriction of 1 liter to 2 liter, it depends on the doctor, rest and exercise, smoking cessation, immunization updates, and medication compliance. For kidney failure, we need to continue on his hemodialysis every Monday, Wednesday, Friday. We also want to watch out for hypertensive crisis while on hemodialysis. So they have nurses on bedside when they do hemodialysis. Usually the RNs are the one who's doing the hemodialysis. We also need to make sure we do monitor for labs such as CBC, CMP, and monitor the site of AV shots, especially on the right upper arm. Patient had history of left upper arm, but he had multiple complications on that. For the primary nursing diagnosis that I use assessing health and monitoring physiological stability related to patients' comorbidities and patients experience signs and symptoms of stroke that is related to AFib and other comorbidities. There are primary nursing interventions we can use, stroke prevention management, especially we need to start aspirin already, statin medication, physical therapy, occupational therapy, and we want to make sure if he needs special, we need to also make sure we do bedside swallow if patient's safe to swallow. Patient needs rehabilitation. We need to discuss psychosocial issues and identify planning necessary for successful community transition after stroke, such as a SNF, possibly. We need to educate the patient and family members about changes in neurological status. We may need to also refer him to neurologists and refer to clinics or outpatients laboratory if he gets discharged at home. Self-care capacity. Prior to admission, patient was very independent, but then the patient developed left great toe gangrene and needed to have amputation. And therefore, patient has deficits on ambulation, balance, bed mobility, and endurance. Since the patient has safety awareness deficits, we need to monitor for fall precautions. Factors that are limiting regarding of patient's condition include pain, decreased strength, and sensation, limited range of motion, poor safety awareness, and limited weight bearing on the left lower extremity. Um, People, a nurse or someone else has to be there, one person to two persons, just to prevent fall. Um, what else? Patient requires physical therapy to restore, maintain, and promote not only optimal physical function, but also optimal wellness and fitness and optimal quality of life as it relates to movement and health. And occupational therapy help to prevent what is it? Help to improve and maintain skills for day-to-day activities and well-being. So patient when patient goes home or somewhere after hospitalization, patients need assistance to see hematologists every 3 months or as needed. Patients need hemodialysis every Monday, Wednesday, Friday, so we need transportation. And also patient needs to see his primary care physician every month. And I'm not sure, I believe the family members will not be able to take care of them at home. Patient issues upon discharge, left grade toe gangrene, status post amputation, hemodialysis maintenance, like I said, the transportation, and who's going to take him there. Patient needs more training on functional mobility, stroke management or therapy and medication compliance, and since, like I said, wife unable to care for patient, including the children too. So discharge destination upon our assessment, including the physical therapy and also the physicians, we decided that the patient should be going to skilled nursing facility instead of like home or home health, because at nursing home there are nurses, nursing assistants, and rehab available. I used to work in nursing home, and I know how the process um, goes in the nursing home for a patient who comes from an acute care hospital. Since patient has self-care deficits, and we need to physiologically monitor the patient until stable. Patient system level strategy that I chose. We need coaching, symptom self-management, and caregiving for family, including teaching the disease process and treatment. We need to teach the patient about the patient's disease process and self-management of symptoms to prevent other complications and to empower the patient to be more motivated. We need to assess health and physiological stability and need support transition. So patient needs to be monitored continuously. For now, with nurses and whatever, like skilled nursing facility, because patient is unstable. Because patient has hemodialysis, disinfection. So basically, we want to prevent readmission within 30 days. So we want to make sure patient will be uh, taken care of once he gets discharged from the hospital. So case manager needs to find a skilled nursing facility and communicate it with the patient and family member. So interventions for patient level strategy. Since patients at risk for self-care deficits due to generalized weakness and fluctuation in hemodynamic stability related to his current conditions, and so it's important to coach the patient about importance of asking for help if unable to do things by himself. And we need to render supervision to each activity until patient exhibits the skill effectively. Implement measures to promote independence by intervening when cannot function. teach a patient about the importance of taking medications in timely manner, and we need support and motivation to increase strength and endurance. We also need to empower the patient to be motivated so we can increase his strength and endurance. We also need to assess the willingness and motivation of that patient. And we encourage to make sure we use teach back method to determine the patient understand what was taught. Interventions that can be done for system level strategy. Assessment and education about signs and symptoms of stroke, DVT or heart attack, fluid overload. We need to make sure the awareness about patients' risk of developing metastasis related to cancer. That's why it's important for him to see like hematologists or oncologists once in a while. It depends on the primary care physician. And we need to monitor for signs and symptoms of weakness, lethargy, or even altered level of consciousness. Since patient had left grade toe gangrene and had status post amputation, patient is at risk for surgical complications, such as another infection developing or severe pain. So I want to look into that. So patient will definitely require skilled nursing facility or acute rehab. So while in the hospital, our utilization review would be we want to prevent readmission. The level of care criteria for him, according to the patient's multiple conditions, ridiculous mobility, increased self-care deficits, wife and children are unable to take care of him at home. Patient requires skilled nursing facility. Patient was recently transferred to ICU because of his hypotensive episode, and we want to prevent, any further downgrade of patient's condition. He should be he's been getting hemodialysis every Monday, Wednesday, and Friday at the hospital. So we check lab results first prior to his dialysis. So we want to make sure what's the electrolyte levels. Patient also needed to be referred to wound care team related to left grade toe wound. Prior to that amputation, we need to do some wound care. So we want to make sure we have the right medication or whatever. We need, recommendation from the wound nurse so that we can relay it to the physician. Also, we need possibly social service related to children and wife unable to take care of patient, and to make sure if they're okay with it, if they're okay with the plan of care for the patient. So we also need to involve case manager. Quality and safety. For this patient, during hospitalization, we do stroke measure protocol, such as like I said earlier, we start him on aspirin, physical therapy. We make sure we do the NIH. We do bedside swallow for safety eval. Make sure patient's statin, if patient's LDL's above 100, and we do CHF measure protocol. Patients should have fluid restriction or some medication, such as water pill or water pill medication like Lasix. While in the hospital, we make sure we do vital signs per protocol. In our unit, we do every 4 hours and as needed. If there are any others, new onset of stroke, we make sure, or other condition that's progressing, such as respiratory distress, we may need to call rapid response. Also, we want to make sure we do fall prevention protocol. Make sure bed alarm is on, call lights is within reach, everything is within reach for him, such as glasses or whatever his personal items are. We monitor labs daily and relay abnormal lab results to the physicians, and we do wound care management protocol. And patient safety goals would be included med reconciliation, which was reconcile, prevent pneumonia and UTI. We make sure patient identification is correct. We make sure medication are also correct, right patient, right medication, right route, right drug, right documentation, and make sure patient had influenza for this season and pneumonia vaccination, which he had also, both of them. Um, and also, we want to make sure patients is actively involved in this. During the hospitalization too, he was IV antibiotics as linezolid and zosyn, and we consulted pulmonologists, nephrologists, neurologists, general surgeon, and hematologists. Patient been on renal diet and he's been having 75 to 100% food intake. Um, make sure we involve family in patient's plan of care, so they're always updated. We make sure they call us or we call them for any other issues that come up. So effectiveness at patient level. Patient able to ambulate from the bed to the hallway with a walker with 1 or 2 person assist. Patient able to communicate needs using a call light. He was able to feed self during meals with 100% food intake. He was able to identify at least one side effect of every medication given. And he understand the importance of taking medication in a timely manner. He was also able to, we were able to teach him able to increase his motivation, and so he was able to change clothes, brush his teeth, and use the urinals. He was able to give us he was able to tell us what can be the signs and symptoms of stroke, respiratory distress, or fluid overload. And he was able to understand why he needs to go to sniff placement. Effectiveness at system level. Patient has no sense of complication from post-surgical amputation of left great toe. So the antibiotic that we give, and also the wound care that we're doing for that patient. So, and also reassessment, make sure there's no other complications arise. Patient was hemodynamically stable related to hemodialysis. No signs and symptoms of fluid overload. Able to tolerate rehabilitation while in the hospital. Such as the physical therapy, occupational therapy. I believe also he had speech therapy, but I don't think he needed it. But he was able to participate on all of them. Patient has no adverse side effects from the IV antibiotic given. Also, the important thing, case manager or management, able to find skilled nursing facility placement who accepted the patient. And the family members were aware about it and they agreed. There are no other signs and symptoms of stroke when he was in the hospital. So this is my references, and thank you for listening and have a good day.